In today's webinar, you'll learn about the latest research on what ACEs are and their prevalence, as well as exploring a framework for addressing social determinants of health inequities. And we'll examine how CDC has used this framework to move its efforts upstream. We'll share the evidence around policies that hold potential to prevent ACEs and the importance of the idea of narrative to reduce inequities. We'll also explore how one state has used this approach, sharing examples of Kansas's advocacy, media, messaging, education, awareness, and evaluation efforts, and also Kansas's work to foster family-friendly work environments, which can help to reduce ACEs. In terms of really being able to gain the most from this experience of being with us on this webinar, you will be hearing your audio through your computer speakers. But if you're having audio issues, that's often related to the bandwidth that you might have. But if you're having trouble listening, you can dial into this number that's right up in the upper left of your screen as well. But if you do that, do mute your computer speakers, because otherwise you'll get a kind of echo effect that is not very pleasant. That all participants are muted throughout, but there's a Q&A area right in the bottom left where you can go ahead. Both Doreen and Todd have already typed in some questions, which is great. At any point during this webinar, feel free to type questions down there for our presenters, and as we have Q&A times, we'll be able to share those. That we are recording this webinar, and we'll make that available within about a week after this session. So know that that's available to you. The slides are already available. If you look up above the slides, there's a file area. You can see the PDF of the slides is right up there, as well as a couple of handouts that you'll have available. And over to the right, there's a link to an article that just came out on NPR about this topic. So yeah. Our presenters today, my name is Jim Vetter with Education Development Center. I'm a member of the Children's Safety Network staff and will be moderating today. And we have with us two really amazing experts to share their experiences and their background with us as well. We have with us Joanne Klevens, and Joanne is an epidemiologist at the Centers for Disease Control and Prevention and has really focused her work around the prevention of childhood neglect and trauma. Also with us is Vicki Roper, the director of Kansas Children's Service League, and really has a lot of practical experience for how to take these kind of policy approaches and use them on a state level. So starting off, we're over to Joanne. Over to you, Joanne.
Thank you, Jim. It's a real pleasure to talk to you all about how we've been trying to address adverse childhood experiences upstream. And I'm not sure the term upstream is a common term but in public health, but what we mean is addressing the causes of a problem. I saw in the poll that about half of you were extremely familiar with adverse childhood experiences, but I also saw that there were at least 3 people that had no idea what adverse childhood experiences were. So I want to talk a little bit about what they are. And here on this slide, what you're seeing are the 10 experiences that the study that coined the term back in 1998 asked about. 5 of these experiences have to do with different types of child abuse or neglect, and the other 5 have to do with household challenges like mental illness, substance abuse, or partner violence, incarceration, and divorce. But since that original study, many people have claimed that there are other experiences that are adversities for children, like living in poverty, racism, being bullied or physically hurt by a peer, or witnessing violence in the community or in your school. There's actually a new study that showed that even corporal punishment could be considered an adverse childhood experience. So I want to do a quick poll to see, thinking about the original 10 ACEs, but also about the other kinds of adversity like poverty, racism, or witnessing violence in the community or in school. How many of you have experienced 1, 2, 3, 4, or no ACEs?
And everyone, just take a moment right now just to respond. So from what you understand about this idea of ACEs, how many ACEs, and again, this is really just We'll only be looking at this in the kind of the total numbers here. So this is just to kind of get a feel for this is a kind of typical group of people coming together. That how many ACEs would you say that you've experienced in your early childhood? Okay, we've got a lot of responses here, Joanne.
Yep, I see. So what I'm seeing is that actually it's way more prevalent in this audience than it is in the studies that we've seen, and it could be because we asked about more adverse childhood experiences. So in the studies that have come out, in the original one, the ACE study reported about 62% had at least one adverse childhood experience. And in the states that have collected adverse childhood experience data on their behavioral risk factor survey, again, it's about 64% report at least one adverse childhood experience. So they're pretty common. It looks like they're very common in this audience. The original study, though, was questioned because the information on ACEs was collected as adults, and so it could be affected by differential recall bias, which is remembering more if you're ill. But since then, there have been many replications of the findings, including studies that have collected information on adverse childhood experiences during childhood. And all these studies consistently find that as the number of ACEs go up, so does their negative effect. So this is what this slide is showing, a dose-response relationship. It's been observed for over 40 different outcomes, and I bet this slide was prepared over 10 years ago, so it could be even 50 by now. So the effects of ACEs aren't because you have one or another, it's the cumulative impact. And while ACEs are relatively frequent, their cumulative impacts are particularly burdensome for some groups of population like low-income adults. They are more than twice as likely to have experienced 4 or more ACEs. And blacks and Latinos are 40% more likely to have experienced 4 or more ACEs. So, what are the consequences of their cumulative impact? Injury, of course, given that 6 of the adverse childhood experiences involve violence, but then also mental illness and poor perinatal and reproductive outcomes. And because adverse childhood experiences restructure the brain architecture in ways that increase impulsiveness, we see more risky health behaviors in adolescents and adults who have experienced adverse childhood experiences. And those risky behaviors, like smoking, of course, lead to cardiovascular disease and cancers, and alcohol abuse would lead to alcohol-related diseases like cirrhosis and cancer of the liver. And then risky sexual behaviors would lead to sexually transmitted diseases. But more recently, we've seen some studies that have connected ACEs to life opportunities. So experiencing early adversity increases your risk of not graduating from high school, of being unemployed, and of living in poverty. So not only is there a cross-generational transmission of adverse childhood experiences, ACEs may also be contributing to the cross-generational transmission of poverty. And I want you to think about that just for a bit, and think about how we tend to view people trying to live and survive in poverty, and how that view could change if everyone understood the impact of early adversity. So how have we been trying to move this upstream instead of just responding to trauma? We've found this framework that I'm showing you here from the World Health Organization's Commission on the Social Determinants of Health to be especially useful. And let me see if I can figure out how to use this pointer. In the first box, oops, okay, so the pointer's here, this first box. In the first box, you see the socioeconomic and political context. And this also includes our societal values, which underlie our policy decisions. So these are policies related to education, labor, healthcare, taxes, the safety net, etc. And these policies create differential opportunities. So I'm going to move to the second box. These differential opportunities determine whether you get a good education. And if you get a good education, that determines what kind of job you can get. And this will determine your income. And as a result, groups of people end up at different levels in the socioeconomic hierarchy. And of course, your socioeconomic position determines your conditions, where you can live, what services you have access to, where your children will grow, learn, and play, even how stressed out you are about your finances. So these psychosocial factors. And then, of course, this these conditions lead to the inequitable burden of health issues and of life opportunities, and this would be the last box. This framework also has this cross-cutting box, which here talks about social cohesion and social capital, but we've been conceptualizing it as more of like collective efficacy of organized communities that are able to change conditions and policies. So what kinds of policies would be more supportive of children and families? Several years ago, we asked a group of experts what policies could address the social determinants of child maltreatment. And we defined it as the conditions in which children grow, learn, and play. And they came up with over 50 different policies. We then looked for evidence of the impact of these different policies on child maltreatment or its risk factors. Where there was no evidence, we started to build it ourselves. And so far, oops, I can get rid of this now. We've been able to find evidence of impact on child maltreatment for all these policies. So starting with the research on temporary assistance for needy families, or TANF, there's research that shows that higher benefits, longer lifetime limits, eliminating the cap on the number of children, and eliminating the work requirements decreases the probability of children in out-of-home care, which is kind of like a proxy for child maltreatment. There's a randomized controlled trial that shows that allowing child support payments coming from non-custodial parents to pass through to the custodial parent instead of the state keeping the money to reimburse itself for any government assistance that the custodial parent might receive reduces child maltreatment. And even though it was just a tiny amount of money, it was like $100 to $180 more, it was associated with a 10% reduction in child neglect. And as an added benefit, a greater proportion of non-custodial parents started paying up. There's also research showing that income supports, like WIC or SNAP, are associated with reductions in child maltreatment. Next, livable wages. There's a difference in difference analysis, which is a study design that for economists is a very rigorous design that shows that a 10% decrease in child neglect, there's a 10% decrease in child neglect for each dollar increase in minimum wage. For tax credits, we have evidence on the earned income tax credit that shows that it definitely reduces poverty, so we know poverty is a risk factor for child maltreatment. But it also has impacts on children's health and school performance with benefits on income and health that extend into adulthood. And then we did our own study where we were able to find a marginally significant effect for a refundable earned income tax credit, but no effect for the non-refundable earned income tax credit. And we think it was just marginally significant because the refund was so small, on average just over $400, with some states as low as $108. We've also just completed analyses on the child tax credit showing significant effects on child injuries, but I'll talk about it in the next slide because it's still under review, and so for now I can only say that it has impacts on risk factors. The evidence for pre-K, high-quality pre-K with parental involvement comes from a controlled trial of the Chicago Child Parent Centers. In this intervention, parents were asked to help out with school activities, either in the classroom or on field trips, but they were also offered opportunities for vocational training and an opportunity to get their high school diploma. They also received at least one home visit to identify needs and connect them with appropriate services. And this intervention showed a 52% reduction in child maltreatment by age 17. Continuity in eligibility for the state children's health insurance program was one of the policies that we examined that showed impacts on within-state trends of child maltreatment. So instead of requiring parents to prove their child is eligible every 3 months, some states do this just on a yearly basis. In that same study, we found that states without waiting lists for child care subsidies also had reductions on within-state trends of child maltreatment. And we also know from other studies that parents that receive child care subsidies tend to choose better quality child care. And higher quality child care reduces maternal depression, which, as you know, is a risk factor for child maltreatment. We funded a study a few years back that took advantage of early Head Start's randomized controlled trial that was conducted in the late 90s. And we retrospectively collected information on the study participants and their encounters with child welfare. And we found that early Head Start children had fewer encounters with child welfare. They were less likely to have multiple encounters, and they had less abuse compared to controlled children. And then the last policy that we have here, we compared the rates of abuse in California before and after they passed their paid family leave policy back in 2004 or 5. And in comparison to states without a paid family leave policy and that had poor grades in family friendliness overall, we found that California did not have the surge in child abuse that other states experienced during the Great Recession. As for policies with impacts on risk factors for child maltreatment, we have the child tax credit, which I already mentioned, but we know that it has impacts on maternal depression, which is a risk factor for child maltreatment. The evidence for conditional housing vouchers comes from a randomized controlled trial that looked at the impact of low-income families getting housing vouchers that were conditioned on their moving to low-poverty neighborhoods. They saw an increase in household income by about $75 a week, which doesn't seem much, but it had several health benefits for the adults. It included reductions in psychological distress and depression. Both are risk factors for child maltreatment. And then finally, we have some evidence for other family-friendly work policies like sick leave, paid vacation, and flexible work time. They are all associated with reduced maternal stress and depression. Again, risk factors for child maltreatment. So now that we have some policies that we can include in this first box, with the assumption that these will help reduce the inequities by race and class, and that will improve the conditions in which children grow, learn, and play, and that will reduce parental stress, depression, and conflict, again, risk factors for child maltreatment, and that all this will lead to a reduction in ACEs, and especially it's an equitable burden among children in low-income households and by race ethnicity. But then the question is, how does policy change? So I want to look at this cross-cutting box again. And we think of it as communities that are organized and changing the narrative. And so now I'm going to talk about changing the narrative. When we talk about narrative, we're referring to the stories we tell about why problems occur and who's responsible for solving them. So right now, our dominant narrative around child abuse and neglect is about those people who are bad parents. We just have to report them and fix them. It's all about reacting to incidents. The dominant narrative around ACEs is similar. I've heard folks that are doing a lot of education around ACEs asking us to think about what happened to you instead of what's wrong with you, and the solution being just getting everyone to be trauma-informed. Again, that's reacting to the problem. It's not preventing it from happening in the first place. So we need to change the narrative. We need to change the way people think about, understand, and approach the problem of adverse childhood experiences. We've learned over the years that cognitive and linguistic science recommend that when we want people to understand a problem, we need to start with our shared values, why this matters. So for example, we could say something like, our nation's future or our state's future or whatever community you're working in depends on how well we foster the healthy development of our youngest generation. Assuring safe, stable, nurturing relationships and environments for all children is essential for our state's future prosperity. So prosperity is one of those values that is shared according to some research that Frameworks did. We all want a prosperous nation. Other shared values are ingenuity and connectedness. And in some later examples, I'll show how you frame these other values. So after we say why it matters, we follow with what the problem or challenge is. But we have to connect the dots to tell a causal story. So for example, we would say, we now know that early experiences literally build the architecture of the developing brain, and that safe, stable, nurturing relationships and environments are key to building a solid foundation for future growth. We also know that not all children have access to the kinds of experiences that will most benefit their development. Some children experience adversity so severe and persistent, it produces toxic levels of stress that harm the brain's developing architecture. So this last message here about toxic stress and the brain's developing architecture has been extensively tested by Frameworks, and it resonates, people understand it. Next, we follow with the solution, but a solution that we implement as a collective. It's not how I as an individual can help out, but it's as a collective, what can we do? So for example, we can prevent toxic stress by providing the kinds of experiences, and you can plug in whatever issue it is that you're working on, be it early child care, early education, work settings that will help parents and provide sturdy foundations for children's development. Research shows, and again, fill in with the issue that you're working on, high-quality child care, high-quality early education, family-friendly work, home visitation, can prevent or alleviate the conditions known to produce toxic stress. And then finally, we have to have an ask. Explain what your audience can do to be part of the solution. For example, you can ask them to visit our website to find out more, or share this information with their family and friends. Educate the community, state, and national leaders on what works in prevention. And as a government agency, that's about as much as we can ask, but advocacy organizations that don't receive tax dollars can have stronger asks. So here's another example, and this one is around the Earned Income Tax Credit. It starts with the value. The future of our state or nation depends on ensuring that the pathways to opportunity are open and accessible for everyone. When we allow any community to struggle, that derails progress for all of us. So this is the shared value of connectedness. Right now, many communities face barriers to the resources that strengthen opportunities, such as good-paying jobs, affordable housing, and quality childcare. When we do not address the needs of our communities, we can perpetuate hardship instead of strengthening opportunity. The Earned Income Tax Credit helps low-income families increase their income while supporting work. So notice that we don't even mention average childhood experiences here because we have to connect the problem with the solution. The last example I'm going to share is around livable wages. So here we say, in our state, we have a long tradition of working together to solve tough problems. And if we hope to have a prosperous future, we need to apply innovative thinking to current challenges and the well-being of our workforce. So notice here, you've got all three shared values. Working together, that's the connectedness, the prosperity, and the innovative thinking, that's ingenuity. So the problem, right now, many jobs don't pay enough for workers to afford basic needs. The cost of groceries, housing, and other basics have gone up, but wages haven't, and that hurts working people and slows down the economy. A living wage helps not just individuals and families, but also our communities and economy. When people have more money to spend, it will boost Main Street and help our communities thrive. So here you see, again, no mention of adverse childhood experiences, but it's connecting the problem to the solution. And this messaging here has been tested in a randomized controlled trial, and it does persuade across the aisle. So I've shared the messages that our consultant, Lynn Davey, has prepared for us for all the policies in that first box. And Jim put it up there as one of the files that you can download. And I think that if you use them consistently, if we all use these messages consistently, we'll slowly change the narrative around children and families in ways that will build commitment to policies that are more supportive of families and their needs. And that's how we're addressing ACEs upstream.
Great.
So we're leaving questions to the very end, and I'll hand it off to Vicki.
Okay, thank you, Joanne. Well, I'm Vicki Roper, and I'm the Prevent Child Abuse Kansas Director for the Kansas Children's Service League, and I'm the chair of the Kansas Essentials for Childhood Project. And I get to say this for the first time, we're a funded state. So we're living in a time of excitement. We've participated in the first 5 years of the project as a self-supported state, and this is sort of the representation of the infrastructure that we set up for the Kansas Essentials for Childhood project. So the Kansas Department of Health and Environment is really leading on website communication. So they've given us a piece of their website. It's at www.kansaspowerofthepositive.org, and you can go there and access the deliverables and that we've been able to produce in the first 5 years of the project. They've also been helping with evaluation. We were the 26th state to do the BRFIS ACE modules, so we're kind of in the middle of the pack, but they've produced a lot of really great reports by individual counties, and then looking at the entire state as well as the by region and by county, and then also the state report. And that's been able to be used in lots and lots of ways, as you can imagine, for training, for grant writing, for ability to be able to message to legislators and to other constituent groups, so that's been great. Then the Kansas Children's Service League as the Prevent Child Abuse Kansas chapter. We've really used probably our networks and relationships to bring people to the table to participate in the project. I've done a lot of the private fundraising in the initial 5 years of the project and will continue to. We've done a lot of the work with the media and then a lot of the advocacy work as well. And then Wichita State University's Community Engagement Institute has been doing a lot with facilitation and particularly with our work groups and then with evaluation. And they've helped produce some incredible tools for our toolkits that you can see online at the website. Our steering committee, the Kansas Power the Positive, consists of about 40 members from different agencies. It's cross-sector, across business, community organizations, faith-based community, family representation, state agencies, foundations, and academia or universities. And the two work groups that we have in place, Raising Awareness, which may change now, but has been involving health, education, social services, child care, universities, business, and philanthropy, and putting in place a toolkit that everyone can utilize and everyone can share with their spheres of influence for their clients, for their partners, for their staff, for their boards, for everyone. And then Kids Are Good Business has been busy working on family-friendly work environments. Again, it's cross-sector, and we'll talk a little bit more about that. But they've worked really hard on developing an employee survey that can be administered and has been piloted across 6 different employer groups.
And so, Vicki, it sounds like you really pulled together a kind of public-private partnership to be able to take the kind of principles that Joanne was sharing and to put them in action in your state. Does that sound right?
Absolutely. I think that would absolutely summarize that slide, is that it's been a public-private partnership to get to impact. Our common vision has just been that all Kansas children live in safe, stable, nurturing relationships and environments, which has been a really powerful common vision for us to be able to recognize that all 40 of those agencies and the people that are coming together representing those agencies have a role to play in creating all of that. And a lot of these were unusual partners and people that hadn't been at our child maltreatment table previously, but that as we started working with the CDC, we could recognize that we needed some different partners and some different partnerships. What was in it, I think for most of us as a self-supported state, is really bringing public health solutions to the work of child maltreatment. We've been used to a lot of child welfare frames at the individual level and even at the relationship level, but this put things squarely at the community and societal levels in the work that, we were able to get done and the partners we were able to bring to the table. And I'm seeing some of you asking questions. I know I'm not supposed to look at the questions, but we, pulled in really unusual partners like law enforcement was, heavily involved. So, and some of the rest of you that see yourselves as unusual partners today, we've been able to pull a lot of those in. So as you all have these kind of collaboratives in your own state, I would say step up because you're needed very much in the work that is being done in this initiative. Okay. The next thing is really a slide that we sort of made up in Kansas Power the Positive. We're working with the KU community checkbox to do process evaluation and to see if we're getting to community change and community impact. And in doing that, what that really looks like is we are monitoring at every meeting at both the statewide coalition, Kansas Power the Positive, and we've now kind of subsumed the Wichita Coalition for Child Abuse Prevention, which initially started to address child abuse and neglect fatalities, and we testified before the National Commission to eliminate child abuse and neglect fatalities, and we're the public health and child abuse prevention story that came out of that in the final report, one of 4 stories, but the only child abuse prevention and public health story. And so what we've done is at every single meeting of both those groups, we've created sort of a one-pager that is this slide and the next few that helps draw us back to what it is that we're trying to get done. And at the end of every coalition meeting, we have folks write on monitoring worksheets that then are entered into our database system with the KU community checkbox, what they've done to address this whole area and move us toward safe, stable, nurturing relationships and environments. So that particular areas that we've divided into are services provided, and a lot of that's delivery of training, developmental activities, actions to prepare the group to address goals. So that may be my orientations of staff, as we've had staff turnover in a lot of our different agencies. Organizational change, new practices to enhance the coalition functioning or increase its capacity. Media coverage for promotion of the initiative or the activities of the initiative. Community action, which is strategies to bring about communities or systems change, and then community change, which is new or modified policies or practices in the system. And this has resulted in a lot of different community change, and we're sort of in the midst of our last year's changes and documenting that. So I don't have those, but up to now, essentially we've had agencies that have changed their paid, family leave policies. One of our, prison systems has implemented a 4-week course around safe, stable, nurturing relationships and environments and ACEs. Our university has been able to utilize a lot of the upstream work that we've done to create upstream work through other grant opportunities and grants, which many of you all are, a part of and can see the connections for that as well. The BRFIS ACE report dissemination and how we want to use that, how we have used that broadly, and then it's helped us to impact and be able to secure a lot more pre-K funding in our state and a lot more home visiting funding. So those are some of the kind of the key things, key impacts. Then this is the training and technical assistance package for child maltreatment prevention that the CDC created, and so we usually have this on that one-pager that sort of shows in broad terms what it is that we're trying to get done and where it is that we're going with the initiative. And then we've divided it into individual areas. So there's 5 areas that are a part of the training and technical assistance package. I'm getting to know this well because my agency's adopted this framework for our strategic plan for the next 5 years. And it's been great to be able to fit everything under there and to keep everything on focus on what it is that we're trying to get done. So in strengthen economic supports for families, which is one of the areas we're particularly looking at now, probably where we've done, the most work has been under the organization section, helping families to access the earned income tax credit. We've been able to create a lot of energy around that at our January meeting, which is probably when you'd expect that energy to come. People in the community that are helping to do free tax returns for low-income families came, and they'd all been trained in early income tax credit, and we were able to direct all of those agencies to get flyers to get them out to their families and make sure that everybody was on the same page in the community about getting earned income tax credit for all of our families. So that was a huge initiative this last year. But the biggest initiative under this has been our family-friendly work policies and work with employers. And I think I'm going to go into that just a little bit more, but that is probably the work that Kansas is the most known for and the work that we've been associated with the longest. Then in changing social norms, what I would say there is that Kansas has the lowest unemployment rate in our history at 3.4%. We currently have 50,000 open jobs. Our workforce now requirement is in order to get entitlements, people need to be working, 30 hours a week. We have moved low income into the workforce, and we're recognizing that their supports that they need. So, for instance, they probably do need that flexible and consistent schedule to get kids to medical appointments, to get to mental health appointments, all those kinds of things. And so part of the social norms work that we're really looking at is also in working with employers across the state, helping to support those families as are coming into the workforce. And there's just tremendous energy around that among our employers. Some of that has been around the Kansas Children's Service League Board because they've been associated with this cause, and they're giddy about being able to work across systems to be able to help impact social norms around all of this. We've learned that through our social norm, we did the social norms survey with Joanne Klevens a couple of years ago and learned a lot from that. And one of the things we learned is that Kansans tend to have attitudes that lay responsibility for children's struggles on parents or individualism, individual solutions. And we learned that that business often hasn't seen themselves as part of any kind of solutions toward child maltreatment. So one of the things that we're looking at is changing that and helping business view themselves as, being a part of social norms change and being a part of the solutions that help support children to be successful and to take a more active role in all of that. And we're starting to work with lobbyists for the Kansas Chamber of Commerce and that we're starting to have focus groups with a wide variety of employers around what these issues are and, what they're really seeing in the workforce as Kansas is moving low income into, some of those 50,000 jobs, what, supports are needed. And it's right in line with the work that we've already done. So I'll share that here in just a minute. Okay, within quality early care and education, and that's been a huge effort for us in looking at securing more pre-K slots and securing more early home visitation slots within the state, and that has been surprising that we really have done that through education and awareness and haven't even had to do that through advocacy, that we've been able to, and I'll talk about this more later, present the slides that we normally present to all of our other partners. We've probably trained about between 5,500 and 6,000 now across the state in adverse childhood experiences and safe, stable, nurturing relationships and environments. And, a lot of this is, within that realm. And after we've made presentations to legislators, they've moved into action to help, support this work. Not even at our suggestion. So they've come back with solutions, and so the education and awareness seems to be really critical. I've seen that in Washington, D.C. as well. I represented Kansas on McPhee legislation with meeting with the Kansas delegation, and it feels like this is very bipartisan in its support, and it's kind of an exciting time to be in child maltreatment prevention because it's so needed and it's really being valued.
And Vicki, as you're sharing these great examples, one of the participants just asked a very little specific question. You've got page numbers on here. What do the page numbers refer to?
Oh, yeah, I should have said that at the beginning. These page numbers are the pages of the CDC's Training and Technical Assistance Plan, and we usually, I don't know if Joanne and Jim know we do this, but we usually have a stack of training and technical assistance plans at every meeting, and so everybody just grabs one, and so as we start talking about what it is that we're needing to get done or wanting to get done at the end of each meeting, they can flip to those pages and see how the CDC has laid out the need for whatever particular piece it is we're looking at. So like earned income tax credit, for instance, then they can go to that section of the plan and read through that. So we just have a one-pager that consists of all of this, and as we work through it, we make those page numbers available.
And Vicki, are you referring to the technical package?
Uh-huh.
Great. Okay, thanks. And I'll put a link to the technical package that you're referring to in the chat here.
Okay, thank you. All right, and then, on intervening to lessen harm, did I just kind of go right over that? So you can kind of see here some of the things, there's a lot around mental health services and mental health systems, and that's become really important. Those have become major needs, for us across the state and in the community as well. Then on education, awareness, advocacy, and educating legislators, I've been asked to particularly, discuss this and to talk about all of this. And what we did, which I've already said, is just give our regular PowerPoints that we do for everyone, with the Kansas Senate and the Kansas House, different committees that are around children and children's issues. And we've done this every year since 2013. So some of this probably built on itself as, people hear this and it resonates and they think about it and they, work through it and they have more questions and they talk, out in the rotunda. Some of this is just sort of taken on a life of its own. We've also invited legislators and spouses to site visits at the Kansas Children's Service League, and, we're a private nonprofit. We would, be considered an advocacy agency. The Voices chapter started, out of our agency and sprung off 30 years ago. We call, our site visits Building Healthy Families tours or Building Healthy Families events. And so we just have great attendance at those. We do them in our Topeka office, which is our state capitol, where the legislators are in session during session, and they get to hear stories. So we present 3 bucket stories, usually a healthy family story and maybe a pre-K story. So they're usually upstream kinds of stories for them to hear and to understand, in sharing all of that. So after our 2017 presentation on all of this, key legislators came up with a plan to redirect funding. That year they also came up with a plan to redirect or to increase pre-K funding, and then the next year they did more of the same. So more funding was directed toward early home visitation in the state, and more funding was directed towards pre-K in that 2018 session. So it's amazing. And what's really happened too is our Department of Education has created a new director of early childhood position, and that person's an advocacy person who is the number 2 person at our Voices chapter. So it's because in this state K-12 is mandated, but early childhood's not, and it really takes an advocacy role to keep that funding and to keep all of that funded.
Vicki,
yeah.
Vicki, that's fantastic. Karen asks, you're mentioning about the state now appropriating state funds to child abuse prevention, and Karen's wondering how much money is Kansas appropriating for this?
Well, we have $63 million, which is all in a Children's Initiative Fund, which is our tobacco settlement funding, and that's on top of our state general fund funding, which is $4 that within our federal funding. So what I'm most familiar with is we've had sort of attempts in the last couple of years to securitize that funding stream, so a lot of our effort has been to avoid that. So what that would mean would be selling that off at pennies to the dollar. So we've been able to maintain that $63 million, which is all for evidence-based early childhood programs. And then what got added to that this year, some of that has come from TANF funding for early home visitation programs. Some has gone to pre-K out of TANF funding for early home visitation programs, and we had sort of an unexpected windfall from the tobacco settlement to the Children's Initiative Fund, and normally we lose that funding to the state general fund for whatever, and this year we were able to maintain that. Our legislators started an early childhood caucus and worked hard to protect that funding for early childhood. Oh, and then the last one I didn't talk about. This year for Child Abuse Prevention Month, we started with a proclamation signing by the governor, and then we moved over to the legislature, and they each chamber did their own proclamation signing. We handed out pinwheels. Usually we hand out pinwheel cookies, and then they have pinwheel pins they wear. We have pinwheels at each seat, in the legislature. We were able to give a speech about child abuse prevention and its importance, and, then we received commendations that are all framed in everybody's offices. It was a pretty amazing day with high visibility, both with the governor, which also the Department for Children and Families, Kansas Department of Health and Environment, the Attorney General. I mean, everybody that kind of touches, all of this, were able to be there and give speeches as well. And then we always have children. So we had children from the child care center across the street that's all low-income kids come over and plant pinwheels in the Capitol, and videos were done that DCF uses and that kind of thing.
And so, Vicki, it sounds like, unlike many states with their pinwheel campaigns, you really tied pinwheels to policy.
We do really tie pinwheels to policy. Pinwheels represent healthy, happy childhoods, and I think, they need to be connected to policy. So with media and messaging, the thing, that I think everybody wants me to mention here is in Wichita, where we've had a string of fatalities and highly visible cases nationally, that we've developed a speakers bureau where anywhere the media talks to, everybody has the talking points and we're all on the same page. We're getting away from individual level where we're blaming the boyfriends. Half of our fatalities have been due to the boyfriends, and it's really easy to go to the individual level and instead go to, we really need quality child care. And so off the individual, level and on to a community and societal level, work. We're using the CDC's suggested practices for journalists reporting on child abuse and neglect in all of our media kits. As the media comes in, we've just finished a big Safe Haven, campaign and have, used their information, and it's sort of just having a good housekeeping seal of approval, and they use that with the work that they're doing, which is amazing to me. We've used as recent photos to start things. We need to get off the level, and we're able to use her to help us with our bullet points. With involvement, we're using, and with an employee, survey and give us information and feedback on what they want to see in the workplace that will support them as a family unit, then we'll support them in the workplace. So you can kind of see, we're doing a survey research guide, we piloted it with business. Here's kind of the list of questions you can probably see. There's no conditions that these come with that they are important to create family workplaces, and that's where we've gone and what we've done, and that's where we are continuing to go. Those businesses that have the survey, think that's been helpful for them to have to be able to understand the needs of the worker and the dose that is needed in the workplace. And it sort of has, again, this pretty good housekeeping seal approval. And, that's really important. So, that's it.
So much. It's a really amazing example of how folks have been taking these kind of general strategies that Joanne shared with us, these evidence-based strategies, and really use them in a practical context in your own state. We've had a number of questions come in from folks, and we have a little time to ask those questions right now. But I'm wondering, for both of you, for Joanne and Vicki, that there are lots of practitioners who are focusing really vital work around addressing the immediate needs of children who have experienced ACEs. So why is it important for us to focus on this kind of upstream approach, on this kind of policy approach, when we know that there's so many immediate needs that need to get met?
I think that's where you have the biggest impact.
I would say that unless you turn off the water, you're always going to be mopping off the floor. And I think that practitioners are so overwhelmed with the number of cases that it would help to prevent them from happening in the first place so that they're not overwhelmed. So you have to turn off the faucet so that you don't keep on getting all these cases coming in.
Mm-hmm. So we know that practically that we're not likely to totally eliminate child abuse and neglect, to totally eliminate ACEs. At the same time, if we take this kind of policy approach, we can have the potential of significantly reducing the number of children who have these experiences in the first place.
Absolutely. And it's joyful to watch all these children that wouldn't normally be being served, but as a result of the advocacy work you're doing, be able to be in underserved communities receiving home visitation programs, or in Kansas, it's our 3-year-olds. We're able to add our 3-year-olds now and truly have a birth to 5, or the start of a birth to 5 system, which we've all wanted for a long time. And so, you're able to watch kids go off to pre-K that would never have had the opportunity and the energy and communities around being able to do that.
Mm-hmm. So being able to see more and more the healthiest childhoods possible, that really keeps folks going, to know that that's a big part of what you're working for.
Correct.
So what about these practitioners that who may have a lot of skill around working with the individual? What kind of role can those people play in forwarding these kind of policy and systems changes? What have you seen there?
Well, I think we've, seen a lot in the Wichita Coalition for Child Abuse Prevention. I think they can come together to create community solutions. So an example of that maybe in Wichita, we had a period of time where moms were coming to the hospital to deliver and had no prenatal care because we weren't processing, paperwork quickly enough. And so the coalition, the hospitals are a part of the coalition. They came together, brought the need to the group. The leaders of the coalition all came together with the health department, folks, and said, how do we make this all happen? And that was able to happen. And so that was an instance where people that were really working at the the individual level were sounding the siren, that they could see that this was happening, and at a systemic level that needed to change and it needed to happen. And so an entire group was able to, step forward and say, we need this.
Mm-hmm. So when individual practitioners can come together in this kind of a coalition, that then they can raise their voices together in a powerful way that can make this kind of policy change?
I believe that. I even believe they can probably raise their voices individually, calling out, a need. I just think it's important to raise our voice, and I think so many times we don't.
Mm-hmm, mm-hmm. So some folks are asking about, I think, on the kind of how we understand the impact of what we're doing in this kind of work. So someone asked the question around, if we're working for this kind of social change, policy change, how do we measure results? Joanne, do you have some thoughts about that?
Sure. What we've been doing is we're tracking the changes in policy. We're tracking the changes in inequities related to race, ethnicity, and income. And we're tracking the changes in the conditions in which children are growing, learning, and playing. And then we're also looking at the outcome of ACEs and their inequitable burden.
And Rafat was asking earlier that, as you're looking at that kind of that change process that you laid out earlier, that can we look at some of those intermediary determinants and track changes in those as a way to start to measure what's happening?
I think so, because until you see changes in those conditions, why would you expect any changes in the inequitable burden of ACEs?
Mm-hmm. So being able to kind of look at and measure each step along that logic model, along that chain, can help us see where we're making progress.
Yep.
And it sounds like there's already been research done that helps demonstrate the links between each of those stages in the chain.
Yeah.
So we have some good we have some good reason to believe that if we see a change in each step, then we're likely to see those end results that we're really going for in the long run. Does that sound right?
I shared some of the research that links the policies directly with child maltreatment or links the policies with risk factors for child maltreatment. So yeah, we have several of those links in the research. Yeah.
Mm-hmm. So knowing that you both have talked about that many folks who care about this issue of ACEs around child abuse and neglect often come at it with this kind of a societal frame that focuses around the individual, that, for example, blaming the parent, or in some cases even blaming the child. That how do you help people make that shift? You talked about it a little bit, but I've been interested in, for both of you, that how do you help people, maybe even people who are working in the field of child abuse and neglect, make that shift to be thinking this kind of upstream approach to focus on policy and systems change? In Kansas, what have you seen, Becky? What helps people make that shift?
Well, I think I loved what Joanne shared about, how to do that, to move things from the individual level to the societal level and creating those talking points. And I think that's a great template for all of us, no matter what it is we're trying to get buy-in for, where we're trying to shift from the individual level to the societal level, is to create those talking points based on the template that Joanne talked about, and then getting that out to everybody so that everybody in the community, is kind of on the same page. I find I have to catch myself all the time because I am being interviewed by the media to just say, okay, I'm given an individual level response instead of a community or societal level response, and I'm not framing this well, and just making sure that I'm able to stay on, on top of that and deliver that. I think it's getting easier as I'm doing it more, but I think that is a shift. And Joanne's probably a lot better at that than I am, and I'm, trying to get there and to do better. It's really easy to give the individual response of, well, our child abuse fatality problems about the boyfriends. Half our fatalities are at the hands of boyfriends, when really that's not what's happening. There's systemic things that are happening that are, creating that problem, and, that we need to be addressing in the community to get community buy-in and a community response.
Mm-hmm. So just the way that Joanne was talking with us about sort of changing the narrative and doing that on a community level through the messages that we all consistently put out, it sounds like we can even do that just in the kind of one-on-one conversations that we're having. Even with our colleagues and with other members as we're developing this kind of coalition to do this work together. So we're just right at the wrapping up to the end of our time right now. Thank you for sharing all that really wonderful information about how we can make a big difference in the long run. That being taking this kind of data-driven approach, we do that right here in the Children's Safety Network. So for all of you who've come and take part with us today, we would really appreciate that you fill out the evaluation. There's a link to the evaluation on your screen. It takes just a minute to be able to fill that out. We really would appreciate it if you would do that. We'll also be sending out within about a week a recording of everything today. The slides are right up at the top of your screen in that files area. That you have a chance, and this entire webinar, plus the slides and the other resources, will be available in the webinar archive on children'ssafetynetwork.org, where you'll see other archives of previous webinars as well. So thank you so much to Joanne Klevens, Vicki Roper, for being with us today, sharing for this information, and thank you to all of you for joining us and for the very important work that you're doing back in your own communities.
Thank you.